If you've ever experienced shoulder or elbow problems, then you know that that kind of pain can ruin your day. But today, I am happy to share that there is a solution for that. And he's here with us today. Dr. Matthew Glazier from TSAOG Orthopedics and Spine is here to talk to us all about the solution to your shoulder and your elbow problems. Welcome to the show.
Yeah, thank you for having me. Grateful to be here.
Thank you for being here. All right, can we get into this conversation around shoulder arthritis?
Yeah.
What is it and how does it develop?
Yeah, shoulder arthritis is something that I see every day.
Wow.
Basically what happens is the normal cartilage that lines your shoulder joint wears out, and so the bones start to rub on each other, which causes pain, stiffness, and loss of motion. And over time, patients have difficulty raising their arm, performing their hobbies and other activities that they enjoy.
I know when I'm not stretching my arm or if I'm overexerting it, I definitely experience a lot of that shoulder pain. Can you talk about when should we consider surgery for something like this?
Yeah, obviously I try to start with conservative treatment first. So activity modifications, oral pain medicine, sometimes an injection, even therapy.
Okay.
But when the pain is so much that you can't perform the activities that you love and it's become painful every day, that's when I would consider surgery.
And are there different kinds of shoulder replacement procedures? I see we have some.
Yeah, actually there are.
Pretty. Does this go in our body?
Yeah, it's crazy. These are just models, but there's different types. So for patients that have an intact rotator cuff and just have bad arthritis, you can do what's called an anatomic replacement, just like this.
Anatomic replacement.
Yep. When the rotator cuff isn't functioning, you actually can perform something called a reverse shoulder replacement. This is probably the most common replacement that we actually do, where we reverse the ball in the socket joint. And so then you use the big muscle on the outside of your shoulder called the deltoid to raise your arm instead of needing the rotator cuff. For young patients, and this is something that I specialize in, for young patients that don't want restrictions after surgery, there's a new type of replacement called a pyrocarbon hemiarthroplasty. This is where we just fix the humeral side of the bone, and then this surface is a lot less stiff and hard than normal steel or cobalt chrome. And so it has less wear and it actually helps preserve the bone.
So after this procedure, they can actually walk away eventually with pain-free and full rotation and functionality in their shoulder.
Yeah, that's the goal.
I love that. Now, what can patients expect right after surgery? Is it a long road to recovery? What does that look like for them?
Fortunately, shoulder replacement surgery has an excellent track record. And so the main thing that it's used for and the reason why we do it is to preserve function and also to help prevent pain and improve pain.
This is awesome. Now, where do you see shoulder replacement going in the next 5 to 10 years?
Luckily, shoulder replacement surgery is an advancing field. There's a lot of new technology, kind of like the pyrocarbon replacement that we talked about earlier. There's new bearing surfaces, new implants. Robotic shoulder replacements are on the horizon. I think TSAOG and some of my shoulder partners will be on the forefront of that and bringing that to San Antonio in the South Texas area.
This is so awesome. Matthew, thank you so much. TSAOG is a one-stop shop for all your orthopedic needs, from diagnosis to recovery. They have 8 locations in the San Antonio area, and you can find Dr. Glazier practicing at the Brook City base and Ridgewood Clinic locations. For more information, call 210-281-9595 or visit the website tsaog.com.